right, so the Resmed S11 unit is what we have here, and we're going to walk through kind of setting it up. The front is going to be a touchscreen display, which we'll see once we kind of get the unit turned on. We'll go through some of the options. We turn to the side here. This is where the water chamber is going to go. So the water chamber has a little flap on the front here. So if you lift on the flap, it kind of splits in half, and you're able to put the water in there. Distilled water only does on this side have a max and a min, max fill line, and then just some guidelines there for you. You'll fill it with distilled water, close this, and then just kind of slide it into the machine. It does require a little bit of a snug fit, so making sure you get a click when you put it in there. And then if we turn to the other side, this is where the SD card is going to go. The SD card is a memory backup. So this machine does have a modem inside that connects to cellular network to send all of the usage data up to the AirView website for monitoring, but it does have a backup memory card here in case it's not transmitting or we need to verify data. It goes label side up. You're going to line it up, push till it clicks, and then it's going to stay in place. And then if you need to take it out, you're going to push till it clicks and it'll pop right out for you. If we turn it to the back here, on the back you have your filters. So the flap just kind of opens up. You've got the filters laying in the top there. You're just going to take the filter out, throw it away, change about every 2 to 4 weeks. Even if it doesn't look dirty, a minimum of every 4 weeks. It may look kind of dirty on the inside and you won't be able to see that on the outside. You're just going to place the filter in the door there and close it. These do not get washed in any way. They're just thrown away and replaced. Also on the back is where the power cord is going to plug in. So the power cord works similar to a USB, so it does have a right way and a wrong way. So if you're not able to get the cord to kind of fit, then just flip it around and kind of push it in there. Now, as far as tubing options for the S11 machine, there are going to be a couple different tubing options. First, you have the climate line tubing. It does have a right end and a wrong end for going into the machine. So the end that has the little chip here is what's going to go into the machine. There's an arrow on the top, and then on the top of the machine there is an arrow. You're going to line those up and push it in. Now the tubing that's connected does change the options a little bit. So we're going to jump into the options and then we'll go back through the other tubing and how that changes the options after we go through this. So on the front of the machine there, again, you can see it just turns on. It doesn't have an on-off. It just sits in standby. The screen will go dark when it's not being used. So there's no powering it on, powering it off. You have two options here. You have My Options, My Sleep View, and then there is also a little more menu down there at the bottom. So if you want to get into My Options, you just touch that little screen. And it's going to give you some of the comfort settings that you are welcome to change kind of at your will. First thing there is your ramp time. So the ramp time is the machine will run at a lower pressure for whatever the setting is, allowing you to get used to the pressures, allowing you to get used to the machine, and then ideally setting it for when you would fall asleep, and then the machine would go to the therapy pressures. Now the S11 unit does have an auto setting. Now an auto setting means that the machine is going to wait until it senses the change in your breathing that happens when you fall asleep, and then it's going to go to therapy pressures, or you're welcome to do it in minutes. So those numbers there are minute increments, so 5 minutes, 10 minutes, 15, and so on. And you're going to just select what you want and then hit OK, and that's going to be the setting there. The pressure relief is an option that is either on or off. So when it's blue, it's on, and then when you toggle it to gray, it is off. This is just a little drop in the pressure when you exhale. Sometimes can make it a little bit more comfortable. Again, you're welcome to change that at will. So the climate control settings that come with the heated tubing has an auto and a manual option. When you set it to auto, the tubing is going to heat to 80 degrees Fahrenheit, and the humidity level runs at 4, which is right in the kind of middle spot there. And if you turn it to manual, then you have the option to change some of those settings. So as we kind of scroll up on our screen here, you would see tube temperature, which is all the way from off to 86. And this is pure comfort settings, so you're welcome to change it based on how you're feeling that night. Some patients will adjust based on the season, so they'll do it cooler in the summer, warmer in the winter, and so on. You'd select the option, hit OK, and then it sticks there. Same thing with humidity. It's either off or 1 to 8. Again, it defaults to 4, which is kind of the middle ground. You want to do small adjustments to this. If you're not sure what your humidity comfort level is, start in the middle and then adjust accordingly. So if you wake up, your mouth is feeling dry, try 5 for the next night, and 6, and so on. And if you're getting a lot of rain out in the tubing or feel like there's a lot of water in the mask, then turn this down a little bit. It is going to vary based on the ambient humidity in the room. So on more humid days, it is going to use less water off of the chamber. But the higher the setting, the more water coming off your chamber there. Now the mask setting is leak compensation. So you want this to be set based on the mask that you're using. So there's full face, nasal, and pillow option. So that just needs to reflect what you're actually using. And then the last 2 features down at the bottom there are the Smart Start and Smart Stop. So again, these are either off when they're gray or toggled on to blue. And they're just an auto start, auto stop. So when you have Smart Start on, you'll put your mask on, you'll take a big, deep inhale, the machine will sense you're connected to the machine and it'll turn on. And then for Smart Stop, you would take the mask off and then it would shut the machine off. If you leave those features off, you just have to push the power button on the top here to start and stop therapy. So put the mask on when you're ready for it to go, press the button, and then the opposite when you are ready to take it off. So those are the menu options that you have when you have the climate line tubing. The other option that you'll have here is going to be the non-heated tubing, which is called Slimline. So the Slimline tubing, as I flip this around back to the back here, it does not matter which end connects to the machine. So both ends are the same. Either end can go to the machine, either end can go to the mask. This also has the option for a tubing elbow. So the tubing elbow just allows for the tubing to have some motion options, so it can kind of turn. It has a big side and a small side. So of course the bigger side would go on the machine, smaller side goes into the tubing, and it just connects to the back here. There's nothing necessary to line up like you do with the tubing there. And then your tubing goes on the front, sorry, on the top there. Now, as far as your climate control settings, they do change just a little bit in that you only have the option to change your humidity level. So you lose the temperature control and that auto manual setting. So you would just adjust the humidity level based on, again, your comfort. Now, the last tubing option that we have here is if your doctor does order for you to have oxygen bleeding into your tubing. If you're using the Slimline tubing here, you would need to use the U-Adapt. U-Adapt just is a connection that allows you to put oxygen tubing on there, and this would allow you to go right directly on the elbow here. So you would just remove the tubing, place the U-Adapt, and then the tubing on the other end of the U-Adapt, and then you would have your oxygen tubing connected to that. So that would be the setup if you have the Slimline tubing. Now the setup for the heated tubing is going to be a little bit different for an oxygen bleed-in. It does still require the adapter. However, because the climate line tubing has this chip that does need to be plugged into the machine, you cannot have this connection at the machine. You would lose the features of the heated tubing. So your climate line tubing would still plug into the back here, and this adapter would actually sit at the mask end. So it would go in between the mask and the tubing. You put it on the end here, put your mask on the bigger end there, and then again, you still connect your oxygen tubing to that little adapter there. Now, if you are using oxygen on your CPAP, there is a specific order that you need to turn everything on. So you do want to turn your CPAP on and start your CPAP before you turn the oxygen on the concentrator. All right, so as far as taking everything apart to clean or to dump your water out, your climate line tubing does need to be pinched. So it'll have two little grooves on the side you want to pinch and pull straight out. It does kind of lock into place there. Your non-heated tubing just has a rubber connection, so you're just going to pull straight out. As far as your water chamber, you're going to pinch the top and bottom and give a little tug to pull it out. It does have rubber gaskets that do connect here, so it does require a little bit of a tug to get it out. And you're going to want to open this up, dump any remaining water from the night before out into the sink. You don't want water sitting in this for any period of time when it's not being used, and you can just set it to air dry. Don't use any sort of towel or anything like that to clean it. Can leave fibers in the chamber and then you end up breathing them in. So